Welcome from Caregiver Cloud to our course on client-centered planning for the mentally disabled. This course will provide information about designing a client-centered plan that addresses the specific needs of a mentally disabled client. People with developmental delays have the same rights to physical and mental well-being as other members of society. The client-centered planning process leads to consistent and kind care for the client with developmental challenges. All care providers can help a client to achieve their potential. A developmental disability is a cognitive or physical disability that begins before age 22. Though the cause can begin before birth, brain trauma and other disease processes can cause this dysfunction later. Cognitive developmental disabilities are conditions that place intellectual, social, and/or emotional function at a significantly lower level than considered normal. With a cognitive disability, the intellect score is below 70. Impaired function may be apparent. Sometimes there are also physical disabilities. Examples include Down syndrome, fetal alcohol syndrome, or brain injuries. Here is a case study. Adam is 22 years old with a cognitive age of 3. The caregiver should expect that Adam will behave with the emotional swings of a 3-year-old. The caregiver must expect Adam to act and react to his surroundings as a 3-year-old. The caregiver must take safety precautions with an adult-sized child who may act defiant, have tantrums, or throw toys. In this situation, it is acceptable and expected that the caregiver will communicate with the client on his functional level. Physical developmental delays are disabilities that affect motor coordination and development. For example, cerebral palsy often only affects motor skills while leaving cognitive function intact. Physical disabilities can become worse over time. Children may be able to walk until the disease process advances and then need a wheelchair when they grow older. When caring for the developmentally disabled, the caregiver should help the client maintain the best possible level of function. This means allowing the client to do all the things that they can do with or without assistance. If the client can feed themselves, this should be allowed and encouraged even if it becomes messy. This may give the client a sense of pride that they otherwise would not have. If the caregiver feeds the client to avoid cleaning up a mess, the client can lose the ability and the will to maintain this function. The client should also be praised for any accomplishment, no matter how small. Proper planning of care can increase the client's quality of life by including schedule changes and integrating new activities. Very few clients, especially young clients, want to do the same things every day. Caregivers should be flexible and use their imagination to come up with new activities. Taking the client for an unscheduled walk on a sunny day can relieve boredom and increase curiosity and wonder. It is important to remember that the developmentally disabled have the same rights as any member of society in regard to physical and mental well-being. Though they are under the legal guardianship of a family member or other person, they still have the right to be free from physical, mental, or psychological harm. They also have the right to medical care and the right to make choices. These clients have the right to be cared for with respect and dignity. Caregivers must always be caring, compassionate, and have patience. Now let's discuss communication tools when caring for a client who is developmentally disabled. The two types of communication are verbal and nonverbal. Developmentally disabled individuals may be able to speak clearly, so communication will be verbal. However, even a client who only has problems with some words can benefit from the proper communication tools if they have a speech pattern that is hard to understand, or they are unable to speak at all. In this case, the caregiver must be creative in nonverbal communication techniques. Watching the client's body language is one way to assess that something is needed. Sometimes the client will point to desired objects. Some clients may also be able to communicate nonverbally with pencil and paper. If the client is capable, a good communication technique is a large poster board with pictures of common objects. The pictures can include foods, toys, different clothing, a tree to indicate outside, and any other things relevant to the client. The client can simply point to the picture of the item they wish to have. Being patient with the client and keeping communication tools at hand are the best ways to decrease frustration for the client. The caregiver must exhibit patience, as being unable to communicate is extremely frustrating for clients. Over time, a caregiver will understand garbled sounds better and be able to do some verbal communication. The caregiver will be more in tune with the client's body language and know what the client wants. Offering a comparable substitute is usually the best option when the client wants something that is a restricted food or item. For example, the client might ask for a food item that is not on the diet sheet, such as candy for a diabetic. In reply, the caregiver can offer fresh fruit slices instead, knowing that this is a healthier option for the client. If the client is a child, just cutting the fruit into interesting shapes may make them happy. Suppose the client wants a small item that could easily be swallowed. The caregiver can offer a larger, interesting, colorful object or toy to avoid the choking hazard. There are many ways to keep a client happy with a bit of imagination and flexibility. Working with people who have developmental delays can be very satisfying. This concludes the course from Caregiver Cloud on Client-Centered Planning for the Mentally Disabled. Copyright 2016, all rights reserved, Caregiver Cloud, LLC.